basic ethical principles of research. Research ethics involves sound research practices and also moral practices as you deal with the subjects of your research. And remember that you also discussed about research ethics committees, and you also talked of the challenges of health systems research, and there are some challenges in implementing health systems research as far as ethics is concerned. And I think my brother here will sum it up and give us a word or two about the ethics of health systems research.
Good afternoon. I think regarding health system research ethics, it was an open forum where we were looking at the best practices, what is best regarding ethics. And I think from the discussion, a lot was said about research ethics. And also, we looked at professional ethics. Mention was made of clinical ethics. But at the end of it all, we narrowed down health system research ethics. And in this case, the main goal is to make sure that as researchers, we consider the integrity and also stick to moral principles as pertains to health system research.
I'll let my colleague add some.
Good morning, everyone. I remember the discussion that was brought up by Chris about what happens when you use secondary data from, or you reference or use secondary data from an ethically sound research. I remember the discussion was about around came up about around recording and publication, but we didn't. I don't remember the consensus that we agreed on. Maybe somebody else can tell us what we concluded.
Okay. So what I remember is we have seen 4 ethical principles. Research should be beneficial, it should not be harmful, and it should be conducted in a fair way, and informed consent must be obtained. And researchers need to get ethical approval, and they should have a sound or valid methodology, and they should make sure that research is conducted in an ethical way. These are some of the things I said. Thank you.
Okay. Thank you so much. And Lydia concluded the day yesterday, and she taught us how to carry out our health systems research, but she gave us a template that we can use in all the other courses, not in ethics only, but we should have our objectives from lower level to higher level objectives. We should have our course outline, we should allocate time, we should use different teaching methodology.
But think about what you're, what you're learning, what's being presented, and the kind of things you need to know if you were to teach this course. What kind of questions should you be asking the facilitators? If there's concepts that you're unfamiliar with, where can you find those concepts so that you are well prepared for your course when you're teaching it? Ideas for each other in terms of how you would test a particular concept from the course, how you would make it interactive and make it really engaging for students. I think as we know that most of these courses are going to be taught to adults, policy makers, PhD students, people that are quite advanced in their careers, and therefore the traditional teaching practices that we're familiar with, where your lecturer stands on the stage and teaches to the class, is not the way that adults learn effectively. And so we need to make sure that we create as interactive a mechanism as we can for the way that we're imparting knowledge and make sure that it's as engaging, as interactive as possible so that our policymakers and our PhD students retain the information for many, many years to come. And so with that, I'll hand it over to Dr. Boite to take us through 2.1. Thank you very much.
Good morning, everyone. Is it good morning or bad morning? The volume is actually not the best. And when I look around for the faces, the group is mixed. Is it a good morning, a bad morning?
Good morning.
A good morning. Okay. They usually say actions speak louder than words. And at times it's challenging. I want always to interface with the people I'm discussing with, but at times there are obstacles in between. I don't know what you agreed upon. About possible obstacles that you may not discuss that may hinder a proper flow of our discussion. Did you have any agreement about that? What are the possible obstacles that may obstruct me seeing you face to face? Computers. It depends, because as I already said, this is adult learning. You do what you agree upon. So if you agreed that you will manage it, that's what we go with. We can't impose anything on others. I also note that actually I read through the short bios of the various participants, not all. Even me, I missed mine. But it's really a diverse group, and I'm glad that already my name is I'm being referred to as a facilitator other than a teacher. Not so. I'm also in the process of learning, and one of my expectations is to learn a lot from you. So I think my role is to facilitate, to make sure that those ideas come up, and also suggest maybe the topics along which we can generate the ideas. As already introduced, I'm Vincent Boite. My background, I'm a medical doctor. I qualified in 1998, and I did practice in the rural Uganda. Those who know Uganda, I mainly practiced in Rakai district, and then I've been teaching for 9 years. I taught at a university called Uganda Matters University in the Faculty of Health Sciences. Among those 9 years, 3 of the years, I was the head of the Faculty of Health Sciences. But in the last 2 years, I left teaching and went into project work. And in the last 1 month, I left project work. I'm doing consultancy work. I'm being pulled, and there are a lot of forces pulling me back to academics. I don't know whether I will withstand those forces, but so far I've succeeded. So briefly, that's who I am, and I'm supposed to facilitate in the topic about research designs. The last one, I think, will be handled by a different facilitator, and I'm supposed to get you through the first 4. we can start right away. So I think you've been involved in these debates, and I'm not surprised that there was a debate, and the debate on research actually will continue as far as we all live, or other human beings live. And one calls a method, another one we call it design, another one we call an approach, so on. And I think it's beyond the scope of us, of this gathering, just to get involved into that debate and bring it to a conclusion, because it's difficult to bring it to a conclusion. So I think also our students, I don't know what's the experience of others, but personally what I prefer also is to not to box the students into one thinking, but also to let them know that they are different ways. As they say, there are different ways of doing what? Killing a rat. One of them is what? You can give poison. One of the most interesting to me is that you can chase it until it gets tired and it dies.
If you are not dead before that.
You can die before Okay. So there are different ways, but I think what we need to understand is are these really competing ways? Are they complementary ways? I think I prefer to discuss with my students. It's generally agreed that design refers to the structure. For all of you who have built, who are intend to build, I think you go to an architecture and they say, can you design for me a house? So it's not the house itself, it's like what the house will look like, what the research will look like. I will say you are talking about the design. And if you say it's about the approach, and then if you search around, actually there are scholarly writings that argue in different ways that no, this is not design, it is method. No, this is not the method, it's approach. But for this, we can adapt that design is about the structure of the scientific work. I don't know whether there is someone else who has a more or a different understanding of what the word design, research design means. Any volunteer who has some kind of additional information that will make us understand more what design, research design is about. Should we say we all understand it in the same way? Should we say we don't understand it at all? Should we say no, we prefer to keep our understanding with ourselves? Unfortunately, I don't know your names, and I will not pretend that I will know. So you will excuse me if I say you. Yes, sir.
As it has been said, a design is a framework which guides how to conduct your research.
Yes.
That is, how to collect data, how to analyze data, how to sample or sequence, and so on. So it's a kind of a guide or which dictates how to proceed with different activities in your research.
Okay.
last point, which sums it up, but maybe I will add there the word systematic. Be kind of a systematic structure.
Systematic.
Otherwise, you wouldn't expect to say collect data before you design the tool. Yeah, so there should be some kind of systematic flow.
Okay.
Otherwise, I agree with that.
So there should be, the design should be put in a kind of logical order, so that so there is already a prescribed order. You think?
Yeah, it depends on the study, but it should follow some systematic. It should follow some systematic.
Okay. Okay. Let me give further what did we say briefly? What did we say about research question? Any volunteer? What you remember you said about research question? Yesterday people were tired, I'm told. They had just arrived. Okay, even if it can be something that you know about the research question, not necessarily that you had it yesterday. Research. Okay. Yeah, briefly for me, what I usually comment about the research question, I usually say there is a problem and there is a problem with the problem. You've heard of such a statement. A problem, then a problem with a problem. The problem is a practical one in the fields. People are not utilizing services in this facility. That is the problem. The problem is that we don't know why they are not utilizing the service. So you set up to a research question and say, what are the possible research questions there? You put a service, people are not utilizing it, and you don't know the reason why they are not utilizing it. So, what are the possible research questions on that? Okay.
Why is the public not using the facility?
Why is? Research question. You say, why is the public not utilizing the service? Another one?
Do the services offered meet the expectation of people?
Okay. So does the service meet the expectation of the people? So that's another question, and all of them may take different directions of research design. What are the determinants of service utilization in maybe this community? It offers from design what is the quality of services that is offered, that are offered in this. So you see, you can take different directions, and then eventually you want to design a research that will answer your question as precisely as possible. So that's the main function of the design, that when I take this design, will I get the answer to my question? If someone closes their eyes here, what could be the reason? Early morning. Tired? I want to be sure I'm not the reason. And you guide me on how I can make you not close your eyes.
What do you mean by close your eyes? Because every time you blink, your eyes close.
Okay. You must be a very analytical researcher. Okay. Close your eyes for more than some seconds. But anyway, we can. Yeah, it is true. I've been given that trick also. That if your boss finds you sleeping on the desk, you just don't panic. You just wake up and say, in Jesus' name I pray. You say, hey, I have a very prayerful employee. So, I think this slide is clear. The design is going to help us to answer the question. I don't know whether yesterday you formulated such questions. I'm aware that the target group of this course, one of the criteria for admission is that someone should have some kind of research concept. And eventually they will be assisted to develop that concept into a research question and then taken through until they develop a full proposal, research proposal. So when you reflect at where you came from, which research question do you want to tackle when you go back? Now, maybe before you take the water, maybe you can volunteer such question you wish to be answered.
I think looking at health financing for universal coverage, so looking at a model like capitation, whether capitation can be used to achieve universal coverage.
Okay. So the problem is that there is no universal coverage. Now we want to know whether capitation is a solution to that. Okay? Yes. Chief, you're looking at me. You want to talk to me?
For me, the question is, are social accountability mechanisms effective to improve performance and responsiveness of national service providers? Are social accountability mechanisms effective to improve performance and responsiveness of national service providers?
Okay. So, what's the problem, the practical problem? Is about utilization?
It's about utilization, but it's first about maternal mortality.
Maternal mortality?
Yes.
Okay.
All the intervention, we try to set up rounds to emphasize on service utilization. So why people don't use the service? There are studies about quality, something like this, but now we want to know if the perception of how the provider behaves can affect how people can utilize and it will change the situation to how the system works.
Because you talk about social accountability mechanisms, people may be accountable, and the community, actually, and the community put pressure for the providers to change their behavior and so on. Okay? So you think that's what you want, you wish to work on. Chief, you worked on many. Which one is coming next?
Okay. For me, I think I want to answer the question on the use of community effort. I want to know if it's feasible to use community effort and contract.
Feasible, whether it is feasible. So, ideally, if I may ask, as I say, there is a problem and then the problem with the problem. So, practically, what's the challenge there?
Challenge
Access to
service.
Access to service. And so, you want to see if we use community worker accessibility to be improved. Okay. Those are examples of questions, and I think as you went through already, you were thinking about, because research is more taught by doing, because as we know, theories can easily escape through the other side. They enter from one side and then exit through the other side. So we want to answer our research question in a convincing way. Who are we trying to convince? When you do research, you want to answer the question in a convincing way. Convincing who? Chief. For you, your research, you want to convince who? Your supervisor? Your colleagues? Scholars? Policymakers? Who are we targeting?
Number one target, I think, will be the colleagues, the scientists, including the reviewers and those who will review my paper and so forth. And the second group will be the policymakers on one hand, on the other hand, the service users.
Service users?
Yes.
Okay. Colleague, if I may ask the question again in the other way, who should be the most targeted and why? Who should we, among the three, we can take the three he has given us, among those, who should we target most? Yes, sir.
The policymaker who is going to make a decision, and it needs to be convinced that the research is sound enough and it's really answering the questions which are arising from the population.
Okay.
So ultimately, you should be the one to be convinced.
Okay. You want to convince the House that it should be? Your neighbor seems to have a...
I'm just thinking, because even the policymaker needs scientific evidence. So if my findings don't make sense to the reviewers and the scientists, I'm worried that the policymaker may find it hard to use the findings to inform policy. So my first priority would be the colleagues, the scientists. The findings should be scientifically sound.
Yes, Chief.
My imagination is that different constituencies might need to be convinced. Because at least for many funding agencies that commission work, at times they have sort of some motive behind some work. I remember recently we wanted to do some work for some organization about community health insurance. And there was that template they just wanted us to write. Even actually the first day we had a conference call about the expectations, they told us the type of people who were going to consume the work. So USID is part of our funders. So you know what that means? So that clearly tells you the type of report that they want you to bring up. So somehow there is now been the politics in this research, particularly coming from the funding agency. Now, the other challenge will be convincing the peer reviewers, the journals, is that we found that there are a lot of biases in most of the publications, simply because there is certain journals that don't want to publish some type of results. In fact, recently I was told they have brought up something called the journal for negative results. Because there are people who do work and find that the question is actually, the result is negative in terms of the question. And they shy away from actually publishing. So work is lying in the shelves. And now they have come up with a new journal that now can say, that is also evidence to read it up. Otherwise, there are journals that say, you see, if we publish this, people are not going to read our thing. Please leave it that side. So that is really the question of who to target. I'm not sure whether we can
I think for your question, the target is relative. Part of it has been answered by Christmas. There are various reasons why we do research, or why we answer questions. Maybe for publication for some, like as the stakeholders have been mentioned. In the question you posed, and the example you gave, of a health facility that is not being utilized, a problem for a problem, with a problem. I think I would go for the users, because that is the problem to the problem. So the research I would do would be targeting the users in that scenario. The others have been mentioned. Depending on where you are and what the politics says, I think you target that particular constituency.
Right. So it's as I think it was mentioned, I think even in the recap of yesterday, that you have the context matters, and that context will also influence the design you are going to take. You have to know your audience properly, and then the design you take should be able to help you give answers to your audience. At times, I don't know, at times who generates is another debate, who generates research questions. Many times, at times, you sit at your desk and say, where is the money now? Which research is likely to be funded. Maybe by putting money, that shows that there is an interest in that area. Times it is your passion, you like to do health economics, so you formulate a research question around health economics. But in this course, and I think one of the challenges I've had is that relate to this course is that a lot of research has been done, but it is not being translated into policy and changes, into policy changes. So having the audience in mind is very, very key in choosing which design to take. And as I said, the design is the one that will help you satisfy the needs of your audience. Okay, these are some of the ways people think, the paradigm. And some people actually you find some people really convinced in the other way, others convinced in the other one. And as we facilitate, we want to stimulate our students to think critically about these ways of thinking. Is there a reality? That's the major question. Is there a reality? Are there many realities? Or the reality is socially constructed, depending on your thinking, depending on your experience? That's usually the question. When you do research, what is your role? Are you analyzing facts, or you are using what the data you've got and then try to say, formulate another way of thinking? You as a researcher, do you influence the outcomes of the research? Do you think researchers can influence the outcomes of the research? What do you think? Do you think as a researcher you can influence the results, the findings? How?
Is researcher or
You want? You are from Rwanda? Oh. Okay. I can sense the French.
The design or the method you choose to use. Yeah. If your research question is answering what? So for example, you are using quantitative method, you will have that reality. But again, if you want to see how, you might again see the reality from a different using different. So I think there are several realities depending on what you have used, and what you use depends on this.
I see in your way, again, the research I always just find out and bring out
from different angles.
Yes. So this is what they say, this is what I found from my analysis of the quantitative data. In the way you have it really influenced the outcome or the findings. Yeah. So you are bringing as is, as found, but from different, you are triangulating. Now, but is there a case where actually instead of finding A, because of the researcher, B is found?
Yeah, I think that is true, because researchers are human beings. They are putting values, they are putting experience, they are putting knowledge. All this can influence the outcome. And that's why many sometimes you need to declare what you believe in when you are giving up the research.
What?
Unconsciously influence the results of a study. For example, the unconscious come from the method that they use to obtain their data and analyze it. If you do not put systems in place that will minimize bias, that will minimize awareness of the kind of participants you're getting and how the kind of data you're getting from them, you are likely to influence unconsciously the kind of data you're collecting. For example, I mean, we talk about these biases in research, where someone unconsciously over-assesses or over-evaluates someone who they believe may actually have a condition. So that is the unconscious, and it's an inherent bias if they do not put in place to prevent it. And that is different, that is like methodology for error. And because when you do your research, you report both the methods that you use to obtain the data and the measurements and the results, people reading your work will tell whether your study actually could have results that are because of that inherent methods that you built in. And that's why it's always important to put in the details of what you did, what did you measure, how did you measure it, what did you analyze and how did you analyze it, and then people can tell. That's the unconscious. But then the conscious one is to do with an investigator, for example, being a member or maybe is funded by the pharmaceutical company and is being paid a lot of money to actually do that research. Yes, he's very good at the science, but has that conscious awareness that should they produce results that are not desirable to the pharmaceutical company funding them, funding is likely to, his own payment is likely to be affected, or his future funding to do that kind of research. Now that one is conscious. And that one they normally want you to declare office of interest and declare who is funding you and who is maybe funding the several years before or ahead, and your relationship with them.
Thank you very much.
You may wonder whether someone started from the answer and then started collecting data, or whether this is true started from data and got the answer. Yes.
Maybe just a comment on that. I think from the discussion we had yesterday about, so that one of the complaints we have is we keep on saying that, oh, those guys from wherever misrepresent us.
Yes.
And part of the reason why we're all into this research is to give our story. And I think if that doesn't come out somehow, then we're missing the whole point.
So, which bias are you advocating for?
There's a reality which is, let's call it African, which doesn't appear in a lot of narratives, and it should come out.
I am not sure I'm getting that. What is that African? Maybe you can illustrate it with an example.
We can go on a platform where we say we remove all bias and so on and just present facts. But that fact, like you gave the example of the one about why we don't go for health services and so on, is a fact that that patient is the same fellow who sees you and then goes to see the herbalist or whatever it is and so on, which is African. So how do you reflect that? You decide I'm going to have a protocol that is, you're trying to say, I could be a scientist like anyone else. In fact, remove my name. You couldn't tell whether I was European. Like now you can't tell I'm Rwandese, can you? You've not made that comment.
No. I'm not detecting the French.
My French accent, 3 layers down. So I think we need to reflect that bias that says that we are African somehow.
So, and it can influence the results of the research?
I'm saying it should. Yes,
and you are saying it with a very tough face.
Yes, that we should get it out there rather than trying to remove it. I think that the general way in which we learn scientific methodology is to remove it.
Wow, I need to be assisted. Someone got here convinced.
I would think, again, the whole concept of context is something you might not explain the get out of because the African realism that you think keeps coming out of most of the work, if I understood you well, in my view is just because of the context in which the research.
But it's not just systems research, that's the fact that we need the context in.
Well, if you're going to write a book, for example, on health systems in Africa, I would clearly see that there's going to be a narrative that comes out, and when somebody reads, they typically see that this is real, the African context of health systems. But what you seem to be saying is that we need sort of, you say we probably need to do anything about removing that so that the research is portrayed as any other research not necessarily depicting this Africanism.
Actually, he's saying the opposite.
Okay.
Yes.
Want to know how much dose of qualitative, the theory behind qualitative research that he has. Because perhaps he might need assistance in terms of studying that subject.
That's what you think?
Yeah, that's what I think. That under normal circumstances, especially when it comes to this right side of the arrow, how we try to remove or to contain. You don't totally remove. To contain it is when you have realized that I'm an African, and this topic, the philosophy, whether Africans have a philosophy or they don't, then if you are, if you, the researcher, is an African, then you try to mix in your team people who are not African, so that as you gather the information, there is this check and counter-check of what information you're getting. So if it's coming from you, basically because you're African, there will be Caribbeans or Australians to counter-check that. And that increases the validity of whatever findings we had.
Okay, allow me to bring this debate to an end. Of course, given that we are going to offer a certificate course, we may not go into those philosophical reasoning and so on, but it does no harm for the facilitator to be at a higher stage or
I think at the level of trainers, we need to have, because we don't know the people we are going to teach.
Yes. I don't know, of course the selection actually or the people need also to take into account into that. A group should be as homogeneous as possible. At times we don't have control over that, because at times when you go into higher discussions, then others get bored. Then when it is too low, then others also get bored. So as we try to select participants into our certificate course, if it's going to be a certificate course, then we can try to group the people. If we have the people at times you don't have enough participants, that you have to put all of them together, and you have to see how to balance to make sure that all of them benefit. But I think the bottom line is that there is a possibility that the investigator can influence the outcome of the study. And the design you take will inform people whether that possibility was too high or it was minimized. So, as we said, we need to answer our research question in the most convincing way by taking the most appropriate design. Generally, if I can briefly explain what this positivism or relativism, critical, there are some people who think that there is reality. As a researcher, your role is to go there and pick that reality. Whether the quality of service, for example, someone said the quality of service in that health facility, whether you like it or not, there is a truth whether the quality is good or bad. It can't be. So that is the positivism thinking. So you go there, maybe with even checklists. That's why they say maybe fixed. even fixed research methods. You go with a checklist. Say, is this there? Yes. Is this there? So you judge from that and say, conclude quite as good or quite as bad. Would you think so?
I would imagine that only would appeal well to quantitative sort of research, where you go out there and you find the numbers and say, look, it is true that service utilization is at 50%, or poverty levels are at 70% or whatever. But I am doubting to what extent that can apply to, for example, qualitative health systems research, because if you are going to do a qualitative inquiry, you just want to ask the question of is service utilization high or no, or low, and somebody will say low. You want to follow up the question as to why it is that low. So
okay, I think that's the next stage we are coming to, and no bad. It's not bad to bring it already. That the positivism usually believes in numbers. What is the percentage? What is the level of our association? What was the power of this research? You go there, there is the truth in that health facility. Either the quality is good or bad. There is nothing in between. And then relativism, we say, well, the quality there, I think they will introduce the word it depends. In a positivism, there is nothing like it depends. It is true or false. So it depends on what? When they say it depends, that's quite in the facility depend on some the level of quality in that facility. If you want to find out the level of quality, what are the issues here saying that will introduce the phrase it depends?
Availability of many of all those are factors that impact on the quality of the service that they have provided.
Now it goes to maybe my question was not clear, but what you are going to again is mainly into the positivism, that you have a checklist and they say if yes, no, yes, no, yes, no. If this is there, you say if 50% of what I am looking for is there, then the quality is good. If it's not there, it's bad. Now I'm asking at the level of conclusion. You've done your research, you want to do your research and you want to answer the question, is the quality in that health facility good or bad?
I think
and someone said, well, it depends.
Is, and of course, now going to what he brought up, is what indicators are you using to then measure that quality? So definition changes, is different in various facilities, for example, depending on what they define it as. So I think it depends on the definition.
Who are they?
So for example, I'll give you, if there is a Joint Commission accreditation, it has its own criteria for quality.
Good.
So if you say then if you measure against that and you meet the requirements, then quality is good for that facility. But then you can use the WHO indicators or definition, which is totally different from the Joint Commission or the COSAL and the others. So I think first define what you mean by quality.
There is another constituency also which has a definition of quality that may not be WHO, may not be, it may not even be in books. Why are people not utilizing it? Yes. Idea when you are measuring quality, their access should be
part of the dimensions, but it also stands alone. But there are so many things that, so when you take quality as a big component, I know quality has different dimensions, but you found that the quality is good. So something else is a factor that is probably making people not utilize the services. Maybe knowledge, maybe seeking behavior, maybe there are so many things.
Would be an issue of cost. Because what these private hospitals of ours, what they can deal with that, and everyone just walk in there and say, you know what?
So according to that woman, what is the quality of that facility?
If she gets a service from a woman service provider and cultural taking the culture, they say that's what the group the assessors.
Good. If it is provided but by a not culturally accepted person. Yes.
So I wanted to bring in the component of you use exit interviews or you use the checklist. If you use the checklist, your products will seem to go back to the positive list.
Yes.
Now, when you use the exit, now the answers you get are really dependent on the people who were answering this. Because to some of us, just spending 2 minutes on the bench in the hospital is, that place is too bad. If you don't get somebody who really can laugh at you, you know, doctors are not told to, you know, client, customer care, somebody is rude, now that for us quality is bad. And yet the technical part of it, somebody is doing their work. So the depends for me is the perception.
Use of the service, if people are not using it. Same relatives who believe in that will actually say, when they are doing the real research, they will concentrate in the community on perceptions. What are the perceptions of the community on this facility? What is their definition of quality services?
Utilization.
Okay. Yes. Now, when I perceive that the quality is good, I'm likely to utilize the service. That's the the connection. Because the question was, if I go to this facility and I assess the quality is good according to standards, WHO, Ministry of Health, but when I look at utilization is slow, I need to ask why.
Utilization may be low, quality. It may be low because the service is quality but it's not available. Maybe you're opening your facility at 4 while people are in the farms. They are not coming to the facility.
So in the eyes of the person who is in the farm, I would say that is not a good quality service in the perception of the client. Is it? Yes. On this.
It could be a client perspective of quality, but there is also another perspective of quality. So we need to know exactly from which perspective we are measuring that quality.
Yes. That's the exact. And as I said, there are some people who believe that the service is put there for the people. And if the people are not utilizing it, it means it doesn't meet their expectations. The best definition of quality, there are so many, is that meet the expectations of the clients and users. So if it doesn't meet the expectations, in essence, for them the quality is poor. And there are people who believe, or who used to believe, that that should be the only evidence that should be based on when you are designing a health service. Go to the people, ask them what they want, and give it to them. Would you?
Responsible. If it is not responsible, you can
So do you think that we should always start from the community before we design the services, and we respond to whatever the community wants? You have to project.
Somebody went to a community and found that they are walking very long distance. So the person sat down and made this project, they sank a borehole for them. Very many people were at the problem. When they were asked, why are you not going for water? They say the walk to the river makes them bond. People talking about their issues, they are able to live together that way. So shortening the distance to the water point was not a solution. They didn't find that it was not a problem that they were going for that long distance to fetch water. So if we want to have a solution, go to the people we want to craft the solution for. Look at them, what do they need? Then go make the solution and bring it to them if you want to be taken.
Okay. In certain communities, they want, if you haven't given them injections, you haven't provided a service. So, in response to that, you'd make sure that you give injections to whoever comes to the service. Pardon?
You can also educate.
It's
not an injection that works.
To design your research. It needs to be based on the quality as given by WHO, or as quality.
The quality are defined by the WHO, as well as the quality. We can do what you say, the mixed design research.
Exactly. So that's what the critical realism is about. There is the quality technically defined by WHO, but also the perception, the interpretation by the community will affect. And I think this we need to realize more and more, and we need to convince our students to realize this, not to go always into the extremes. I've seen we do mass immunization here. I was a young medical officer based in one of the health facilities in rural. So we are immunizing against polio and measles. But I didn't know the ladies actually can run. You will see a lady, one child in the back, another one being carried, and she's taking up at a very fast speed from us when we arrive. with the what? With the vaccines. So, we science have concentrated a lot about what works scientifically, forgetting that the interpretation of the community, of the people, also affects the effectiveness of the intervention. You know the vaccines work, they have been taken to the blood, they have been tested, the power was so strong and so on. But here, children are still dying because of the interpretation. So it's very critical that actually we mix. It is very critical that we mix and we see the interface. So those are the thinkings. There are some people, I was surprised. Someone who is embedded in the relativism, will tell you that computer is not a computer, it is your construction that is a computer. They can be that extreme. This is not a table. Those are social constructs.
That's true. A table is just a symbol. A table is just a symbol, even a glass. That's why wherever you go, you may experience a different table, but you just say it's a table.
It's a table.
Not a particular table, or maybe a podium like that. Because there are different kinds of podiums. So just have to have the concept of a table or anything, such that wherever you are, you will kind of reflect. So it's like entities in the world are simply the images of the ideas of the mind.
Okay. This is a glass, because it is made of this material and this. The period. It's a glass. So there are some people who go into those extremes, and the discussion can actually become. Human beings can change.
And so your scientific take a positive nature.
No, I think human beings can change. So this is all learning. And things can be unlearned. The problem is that if you have already learned something, to unlearn it is very, very difficult. It takes some energy, some proactive effort. But many of the behaviors of human beings can be unlearned and changed.
Is it possible these days to write research, just go do research, throw the facts there, throw the facts there, throw the facts there, and that marks the end? Because that is what it is, that you go pick the facts as they are, throw them there. Somehow, in the conclusion, you must sort of make sense of these results. Well, I know sometimes economists used to do those kind of things. They run their econometrics model and then just come up with those relationships. They conclude that poverty is related to household education or level of education. In terms of when you would be making concrete recommendations, I somehow think you end up jumping a bit into the realism, relativism aspect of it. So,
yeah, many of the researchers they did research and in their models and say concluded circumcision can reduce the spread of HIV.
But I think
people are not running to do what? Circumcise. So circumcision, an effective way of controlling HIV. That's why someone will introduce it, depends.
have also to take into the people's interpretation of the facts. You have the facts, but those facts, for example, here people, the Catholics can argue that that is now an effort to make a Muslim. And the moment that one spreads, many people will not come for the circumcision. But you, as a positivism, you did your research, you did your analysis, the simulation, what your models, and you say, actually, circumcision is the way to reduce HIV. You policymaker adopt this, but you can't adopt it without bringing in the aspects of how the people will interpret it, how will the people see it. Yes, sir.
Yeah, I'm trying to figure it out that all the three are applicable at their own period, time, and context. If one is doing genetic engineering, one is studying on coming up with new drugs, I don't see relativism in it as you are trying to find that drug. And if one is studying why does he believe in this religion and he doesn't believe in it, I don't see positivism in it. So these are extremes. So what I want to see here is, like, if we are studying health systems research, maybe most of our issues or questions will be somewhere in between. So it's kind of a bell shape. There are certain studies that are purely positivist, and others are purely realistic. But in between here, you have the mixture, and especially for health systems research.
It's a very, very good conclusion.
And I asked a question to that. Timber has brought in the aspect of certain researchers just being anchored in a particular ideology. You talked about the drugs, for example. If you use the example of ARVs for HIV, and I think there was research, they are effective in improving, I don't know, they call it cell count, I'm not sure. But now there are new researchers that are taking the perspective of how can we increase adherence. So there is one aspect of the research that is saying ARVs are really good, are effective. And now the new researchers that are talking about how you can increase adherence are bringing in the aspect of but this can only happen if the level of adherence is this. So I think for me, the point is...
Point of information. I think the idea is, I think the bottom line is, what is your research question? What is your constituency? Who do you want on this? So it will depend on which side. If you are on this in the scientific world, you can go into the positivism and already dig out facts and bring them on table. If you are convincing the community also to be involved, you may need to have their view